Members of the World Health Organization have now overwhelmingly voted to adopt the first treaty aimed at preventing, preparing for, and responding to any future pandemic. And a big key thing is that the United States is not one of the countries, since Donald Trump signed an executive order pulling the US out of the organization on his very first day back in office. And in fact, with that, the Trump administration is now also reportedly poised to restrict access to COVID-19 vaccines, which is notable because, the COVID-19 pandemic, it's the whole reason that we have this treaty in the first place. Right? And actually, starting there, these talks started way back at the end of 2021. With the head of the World Health Organization claiming the previous year and a half had shown a light on the many flaws in the global system to protect people from pandemics. And since then, we've seen the whole effort almost fall apart thanks to false claims that the treaty would involve countries ceding sovereignty to the World Health Organization or give it the power to impose lockdowns and vaccine mandates, which, to be clear, is not the case. Right, the treaty, it establishes a framework that's meant to try to prevent pandemics from even starting, right, including things like boosting surveillance of animals to lower the risk of viruses spilling over to humans. It then also lays out steps for responding more effectively once pandemics happen, like getting protective equipment to healthcare workers and aligning regulatory systems to expand access to treatments. And after years of negotiations to work all that out, no country voted against the agreement, with 124 voting in favor and 11 abstaining. Now, with that, the treaty won't go into effect until at least 60 countries have signed and ratified it, and that can't happen until a few final issues get resolved, with one of the big remaining sticking points having to do with the creation of a so-called pathogen access and benefit sharing system, which basically would be a way for countries to share genetic information and other data about dangerous pathogens in their territory in exchange for access to vaccines and treatments. And then beyond that, the agreement also outlines a goal of having pharmaceutical companies donate or make more affordable 20% of the pandemic products they produce, with Helen Clark, the former Prime Minister of New Zealand and co-chair of the World Health Organization's panel on pandemics, saying many gaps remain in finance, equitable access to medical countermeasures, and in understanding evolving risks. Don't wait to get started. Dangerous pathogens are looming, and they certainly will not wait. Although with that, I will say not everyone agrees. Right, a lawyer with the Third World Network, for example, which is an international NGO focused on health and developmental issues, you had them saying that the World Health Organization's insistence on concluding negotiations at any cost had pressured lower-income countries into giving in on key elements of the deal. And notably, despite the US not actually being involved, Trump may still be to blame for that, with you having one person involved in the negotiations pointing to the escalating bird flu epidemic in the United States and the anti-science approach of the White House as a reason for rushing things, with him saying, quote, "Everyone felt like we need to get something. You don't know when the pandemic will happen. We can't wait for another 3-4 years." But then with that, the agreement's ultimate impact, it remains unclear. And again, that is largely due to the Trump administration, because the US has historically been the World Health Organization's biggest funder. And even before this treaty, you had public health experts saying that Trump's decision to leave it could have a major impact on its ability to respond to outbreaks as well as achieve long-term public health goals like eliminating malaria. And now you have his Health and Human Services Secretary, RFK Jr., speaking out against the new treaty and instead calling for a reboot of the whole system, with him claiming, quote, "The World Health Organization has not even come to terms with its failures during COVID, let alone made significant reforms and continuing. Instead, it has doubled down with the pandemic agreement, which will lock in all of the dysfunctions of the World Health Organization pandemic response." And then with that, he encouraged other states' health ministers to consider joining him in what he called a new era of cooperation outside of the World Health Organization. And all of this, as I mentioned, within the United States, we're seeing the FDA now limiting access to the COVID-19 vaccine, specifically for most healthy Americans under 65, with the agency saying that manufacturers would have to conduct randomized controlled clinical trials before updated vaccines would receive approval for healthier people. And there, to be clear, health experts have said that there are legitimate questions about how necessary or beneficial it would be for everyone to get vaccinated if they're low risk. With, for example, one former federal vaccine official telling NPR, the FDA is signaling a major departure from the one-size-fits-all approach that's largely defined the US vaccination policy until now. Not everyone is at equal risk, and public policy should reflect that reality. Though this is, on the flip side, you have critics saying there are a number of issues with the decision and the way that it's being made. Right, for one, this is happening without the usual input from independent outside advisors. And that, even though there's actually a CDC panel scheduled to debate which vaccines should be recommended to which groups in June. Then two, there's concern that this could make insurance less likely to cover COVID vaccines. And three, connected to that, they say that given the overwhelming evidence that COVID vaccines are safe and effective, what this policy is really doing is robbing people of choice. They're saying that some people might want to get it just to be extra safe, and some might want it to protect other people, such as older family members and those with weak immune systems. Right? And so with that, you had one doctor telling the New York Times that he thinks changes like this will lead to more unnecessary deaths. And then another saying it does seem to be based more on this administration's hostility to vaccines and resentment of COVID prevention methods. And adding, "I think this is setting a dangerous precedent."